Hello everyone, I am Dr. Mahalakshmi. In this video, we are going to see about cardiac poisons. So, cardiac poison, first in this chapter, we have to know what are all the cardiac poisons. So, first the classification is important. So, first we can remember cardona. So, cardiac poisons are dona. So, first D for digitalis, O for oleander, N for nicotine, A for aconite. So, these are the four important cardiac poison that we usually see. So, cardona, cardiac poison, D for digitalis, O for oleander, N for nicotine and A for aconite. Now, we will see about each and every cardiac poison and how it will present. So, first is aconite. So, in all these poisons, if it is a plant poison, the first thing that you have to know is this, how it will look like. They will give you the picture and they will ask you to identify whether this is a cardiac poison or not. And then if it is, what is the name of the plant? They will ask you that. So, this is how the aconite will look like. It is also known as devil helmet, blue rocket, Meta-Zehar. All these are other names for aconite. And why this is known as Meta-Zehar is that it is highly poisonous, but it is sweet. It is very sweet, and sometimes people may mistake it for horseradish. Okay, it is mistaken for horseradish. And they may eat the root. So, we have to know which part is poisonous. Root, it is highly poisonous root. All other parts, every part is also poisonous. So, first we have to identify the plant, then we have to know which part is poisonous. We also have to know what are the other names for the plant. Then we have to know the active principle, the alkaloid that is present in the plant that will lead to all the adverse effect. So, here the active principle is aconitin. This is the active principle, the alkaloid that will lead to all the adverse effect and cardiac toxicity. So, aconite, you have aconitin as active principle, and what does this aconitin do is, it will cause sodium channel activation, which will lead to premature excitation of the myocardium. So, it will open up the sodium channel. Because of that, there will be depolarization and the myocardium, it will start exciting prematurely. So, because of that, there will be cardiac toxicity. And this premature excitation means what will happen? If the heart is not getting excited at the right time, it will beat at various interval, right? So, it will lead to arrhythmia. So, the patient will die because of ventricular fibrillation. So, it will activate the sodium channels, leading to premature excitation of the myocardium. Because of this arrhythmia, they will get arrhythmia and they will die because of ventricular fibrillation. Aconite, active principle, aconitin, all the parts are poisonous. So, this is the main important thing in this. Now, there are certain features that you expect to see in aconitin poisoning. Apart from this ventricular fibrillation, you will also see something known as Hippus, which is alternate dilatation and constriction of pupil. So, these are the important symptoms that you can see in this aconite poisoning. You will be seeing this arrhythmia and Hippus, which is alternate constriction and dilatation of the pupil. Now, medico-legal importance of this aconitin is that it is an arrow poison. This aconite, it is used as an arrow poison and it is mistaken for horseradish, and accidental poisoning will happen. There is chance for accidental poisoning. And cattle poisoning also, it is used one of the method. So, it is an arrow poison, cattle poison, and it is mistaken for horseradish and it will lead to accidental poisoning, and it is also a ideal homicidal poisoning. It is very sweet in taste, so people, they will not notice anything and they will give this for killing there will be instant death. So, this is an ideal homicidal poisoning. Clear? So, first cardiac toxicity we have seen aconite. Now, what you are going to see is this. This is Nicotiana tabacum. This is Nicotiana tabacum plant, and what is the active principle in this is nicotine and anabase. So, here all the pots, here also all the pots are having this alkaloids. This nicotine and anabase, what it will do is, it is a potent agonist of all the acetylcholine receptors. Okay, this acetylcholine receptors, it will go and activate. Because of that, you will be having all the nicotinic receptors, right? All the nicotinic acetylcholine receptors will be activated. There will be constant firing. Because of that, initially you will have all the vitals going up. You have the BP going up, you have the heart rate going up, and then respiratory rate going up. There will be complete stimulation. And once it keep on going, once the acetylcholine keep on firing, at one point it will start slowing down. There will not be anything to excite, so there will be complete depression. Complete depression will happen, finally leading to dyspnea and respiratory arrest. This can happen, and in the myocardium there will be depression. Depression of myocardium. So, because of that, they will die because of heart failure or respiratory failure. So, this nicotine, through their nicotinic receptor, it will activate everything. There will be constant firing, initial stimulation will happen, after that everything will be depressed, leading to cardiac failure and respiratory failure. And the active principle that lead to this is nicotine and anabase. And what is the antidote for this Nicotiana is that the physiological antidote, atropine. For nicotine, you will give atropine, which will counteract all the activities of this acetylcholine receptors. So, antidote is atropine. Apart from that, you can also give whole bowel irrigation and activated charcoal, because it will take lot of time to liberate from the stomach. So, you can do this activated charcoal and whole bowel irrigation as decontamination. So, main mode of management is giving atropine for decontamination. When there is large amount of ingestion is there, you can do. And in case of postmortem, you will be able to see brown color stain in mouth and stomach. This Nicotiana, it will leave this brown color stain, and in the stomach you can see erosions and congestion. In the lungs, you will be able to see pulmonary edema. Because of its depression, it will lead to pulmonary edema. And when it is applied to the skin, it can cause blister. So, blisters and vesicles you can see in the skin. The medico-legal importance of this is that it is mainly used for malingering. They will apply these Nicotiana leaves over skin and they will say, I got injured. And they will give and complain that he did this to me, he poured acid over to me and I got this injury because of that. They will come and complain. So, this cutaneous eruption for malingering they will use. And what they used to do was, for giving the killing the insects, they were using this as an insecticide. And for killing infants, what they will do is, they will crush this leaves and they will apply the paste over the nipple, and when the baby sucks for the breast milk, it will ingest that also and it will die because of cardiac failure. So, for infanticide also this Nicotiana was used, and whenever there is this application to the skin, it will lead to brownish discoloration. There will be brownish discoloration of skin. So this brown color is very typical of this Nicotiana tobacum. So Nicotiana, the active principle is nicotine anabasine. It will activate all the nicotinic receptor, acetylcholine receptor, and it will lead to initial stimulation and later depression. And you will be getting to see brown color discoloration and cutaneous eruption. It is used for infanticide, insecticide and malingering. So we have done aconite and nicotine. Now we are going to see this. This is Cerebra odollam. So this Cerebra odollam, this is also a cardiac poison, but very rarely. So what is that? This is mostly an accidental poison. So this is an accidental poison, and this, if you look, it will resemble a mango tree, mango like appearance. So people will mistake it for mango and they will consume the fruit and they will die. So the other name, it is also known as suicide tree. So people who want to kill themselves, they will take these fruit or they will take the seed, they will crush it and they will eat it and they will die. So this is also known as suicide tree. And how it leads to death is that it will cause blocking of calcium channel. The mechanism of action is it will lead to blockage of the calcium channel in the heart, and because of that there will be cardiac arrest. And the active principle that leads to this is serapine and odollotoxin. This is the active principle that will cause the toxicity. Serapine and odollotoxin. Medico-legal importance is that it is mostly an accidental poisoning and sometimes suicidal. So this is the medico-legal importance for this. Next is this. This is your Digitalis. So Digitalis, it is also known as Foxglove. This looks like a finger, right? This flower. Because of the name, Digitalis is given. So this purple color flower, what it will happen is that all the parts are poisonous. And you have the active principle digoxin and digitalin. This active principle, what they will lead to is that they will cause all sort of arrhythmia, all sort of cardiac arrhythmia, and you will get diplopia, visual disturbances. All these things happen because of this. So the patient mainly die because of cardiac failure due to arrhythmia. And this Digitalis, it has an antidote known as Digibine. This is the specific antibody to Digitalis, and you can use it for treatment. So Digitalis, it will lead to all sort of arrhythmia and it has an antidote known as Digibine. So this is for Digitalis cardiac toxicity. Next you have Oleander. So Oleander, here also all parts are poisonous, especially the nectar of the flower. So this is poisonous, and the active principle here is Nerium and Oleandrin. These are the active principle. Here what they will do is they will inhibit the sodium potassium ATPase in the heart muscle. In the heart muscle, they will inhibit the sodium potassium ATPase pump. Because of that, the patient will experience arrhythmia and myocardial degeneration. This will lead to cardiac arrest and death. So you basically have these many cardiac poisons. First you had aconite, nicotine, then you have Cerebra odollam, then you have Digitalis and this Oleander. So these are the important cardiac poison. In this, aconite is very important. They will ask you what is the resemblance to horseradish, and they will ask you what is the active principle in each and every poison, and you should be able to identify the plant by looking at the picture of the plant, and the medico-legal importance is also asked in few cases. So with this we are ending this cardiac poison. Thank you.